Knock, knock. Hi, Stacia.
Hi.
Hi, I'm Debbie. I'm a student from Nevada State College. I'm here to do your physical assessment today. First of all, I'm going to start by cleaning my hands, and I'm going to pull the curtain for privacy. Next, could I have you state your name?
Stacia Harper.
And your date of birth?
May 9th, 1997.
Perfect. I need to ask you a little bit about your medical history. Are you allergic to any medications?
No.
Do you have any allergies towards anything at all, grass, pollen?
No.
So no known allergies?
Mm-mm.
Are you currently taking any medications?
Mm-mm.
Any vitamins or supplements?
Nope.
Okay. Next, I need to ask you about your medical history. Do you have a medical history of any diseases?
Mm-mm.
Have you had any trauma?
No.
Have you ever been hospitalized?
Nope.
Have you ever had any surgeries?
Nope.
So no surgeries, no hospitalizations. Perfect. So you're perfectly healthy, no medical problems at all. That's wonderful. Next, I need to ask you about your activity level. Do you currently do any exercise, or are you active in anything as far as activity?
I dance.
And how often do you dance?
Every other day.
And for how long?
A week. No. A few months.
Okay, and each time when you do your dancing, how long is that period of activity?
Like an hour and 30 minutes.
So an hour and a half every other day?
Mm-hmm.
Do you enjoy that?
Mm-hmm.
Wonderful. Do you do anything else as far as activity?
Not that I can think of.
Okay. Do you smoke cigarettes?
Mm-mm.
Do you smoke anything at all?
No.
Do you drink alcohol?
No.
Do you use illicit drugs?
No.
Are you sexually active?
No.
Perfect. Could you tell me the date today?
December 8th, 2015.
And can you tell me the President of the United States?
Obama.
And can you tell me where you're at right now?
Las Vegas.
Okay. And what are you doing right now?
Talking to you.
Okay. And can you tell me your age, please?
I'm 18.
Okay. And I'm going to just look at your skin, please. Okay, so patient is alert and oriented times 4. She has clear speech. She appears to be the age that she has stated. And her skin color is normal with her ethnicity. Now, for this next part of the assessment, I'm going to just examine your head, face, scalp, and neck. Okay? So I'm going to just look through your hair. Do you have any sores?
No.
Any open wounds on your head or any lumps?
Nope.
Okay. As far as scalp goes, her scalp is intact. There is no presence of sores, wounds. I don't see any rashes. Her skin on her face is clear, dry, intact, without any lesions, no sores. Skin color is even tone. Next thing I want to do is I'm going to look at your eyes. Her eyelashes the hair on her eyebrows are evenly distributed bilaterally. They move appropriately with her facial movements. Her eyelashes, the hair is distributed evenly bilaterally on the upper and lower lids. I'm going to just examine your eyes. Can you look up for me? Can you look over to the right, the left, and down? Okay. Her sclera and conjunctiva are clear. There's no redness noted. As far as her upper and lower eyelids go, I see no discharge, no swelling. I'm going to just examine your pupils. Can you look ahead for me? Her pupils are round. They're equal bilaterally, and they react to light. The next thing I want you to do is look ahead at that wall and focus on something straight ahead. Are you doing that?
Mm-hmm.
And then accommodation is intact bilaterally. Next, I want to have you open your mouth and say ah. Uvula is present midline. Tonsils are pink with +1. Gag reflex is intact. That's cranial nerve 9 and 10 is intact. Next, I want you to, can you close your eyes tightly for me? Squint your forehead. Smile. Puff out your cheeks. Okay, cranial nerve 7 is intact. The next thing I want you to do is stick out your tongue. Lift your tongue up. Lift your tongue to the right, to the left. Cranial nerve 12 is intact. Tongue is midline when it protrudes. Next, I'm going to examine your nose. Nose is straight. I'm going to test your nose for patency. I'm going to close your nostril and have you sniff upward, please. And your other side. Nose is patent. Next, I want to examine your ears. There's no lesions, no thickening of the ears. Ears are even on both sides bilaterally. They are consistent in shape bilaterally. No deformities noted. Going back, I would like to say that the patient's mood is appropriate for time and situation. Now I'm going to just examine your neck. Trachea is midline. No masses, no abnormalities. Skin is dry, intact. I'm going to listen to your carotid. There are no buries heard on the carotid. And I feel pulses bilaterally on both sides. Can you please turn your head towards my hand? And on the other side? Perfect. Can you lift your shoulders up? Shoulders and face have strength against resistance +5, excuse me. Now, the next thing I want to do is examine your stomach. Could you lay down for me? And examine her abdomen. I'm going to just pull your shirt up a little bit, okay?
Mm-hmm.
In looking at her abdomen, I see no pulsations along her abdomen. Her color is even consistency, no striae. Skin is dry, intact, no rashes, no presence of wounds. The next thing I'm going to do is I'm going to listen to her bowel sounds. Normal reactive bowel sounds heard throughout all 4 quadrants. The next thing I'm going to do is I'm going to percuss on your abdomen. I'm hearing tympani throughout. Tympani. and dullness. Next thing I'm going to do is I'm going to, can you bend your legs for me, please? I'm going to palpate softly. Any pain?
No.
Okay. I'm going to go a little bit deeper. Does that hurt?
Tickles.
Okay. Try to relax. I'm not feeling the spleen. I can't make out any abdominal organs at all. Can you please sit up for me? Okay. Turn. Can you grab my hands? Grab my hands. Squeeze tightly. Grip strength is equal bilaterally in both hands. All right. Can you push against my hands? Let's push in. And in lower extremities, her strength is equal bilaterally. Next thing I'm going to do is I'm going to check your triceps reflex. Let's just pull up your sweatshirt a little bit. Let me pull this one out. While I'm doing that, I notice her skin is dry and intact with no lesions, rashes. Okay, try to relax your arm, please. Okay. Okay, +2 on that tricep. And +2 there. Relax your arm and spine. Okay, positive on bicep. Positive on the biceps. Triceps and biceps reflexes are equal bilaterally. Next, I'm going to do her patellar reflex. Just try to relax. Okay. Perfect. Normal reaction on the patellar reflex bilaterally on both sides. Now I'm going to check her Achilles. And she has +2 reaction on all deep motor tendons, the patellar, biceps, triceps, and Achilles. Now, next thing I would like you to do is, can you get down for me? All right, can you bend over for me and touch your toes? Try to touch your toes. All right, I'm going to just examine your spine. Her spine is straight. Her skin has no lesions. It's dry, intact, no rashes. Skin color is consistent. Next thing, can you turn around and face me? All right, for this test, it's the Romberg test. I'm going to ask you to put your hands down at your side and close your eyes tightly and just try to stand there straight. I'll be here to catch you. 5 more seconds. 2, 1. You can open your eyes. Romberg is negative. Now, for the next thing, I would like you to walk across the room, and I'm going to check your gait. And turn around. Perfect. Gait is appropriate. No problems with gait. Can you sit back up here? I need to check one more thing. Can you turn around with your feet up here? I'm going to just check for CVA tendency, tenderness. Tell me if this hurts. No. No tenderness noted. Okay, can you turn around for me? So Stacia, I found that your physical assessment, your reflexes are within normal limits. As you are doing great with your health, keep up with your activity. Try to increase it by doing other activities on the days that you aren't doing dancing. You're doing a great job as far as avoiding alcohol and tobacco. That's wonderful. Do you have any questions for me?
No.
Okay. If you have any problems, please come back again and continue to do the things you're doing. You're doing great with your health.